Welcome to Emergency Insights. I'm your host, Kim Barker. Today, we're looking at the classic presentations of cholinergic toxicity. For those of us in the emergency department and critical care, recognizing these signs quickly can be life-saving. We often use two very helpful mnemonics to remember the key symptoms, SLUDGE and BBB. Let's start with SLUDGE. This mnemonic captures the secretory and excretory effects of excess acetylcholine on muscarinic receptors. S is for salivation, an excessive production of saliva. L stands for lacrimation, or tearing. U is for urination, often an involuntary voiding. D is for defecation, which can present as severe diarrhea. The G is for gastrointestinal distress, with symptoms like abdominal cramping. And finally, E is for emesis, or vomiting. When a patient presents with a combination of these symptoms, think about a farmer exposed to pesticides or a patient with a nerve agent exposure. Your mind should immediately go to cholinergic poisoning. Now, let's move to BBB. This mnemonic focuses on the cardiac and respiratory manifestations, which are often the most life-threatening. The first B is for bradycardia, a significant slowing of the heart rate. The second B is for bronchoconstriction, a dangerous narrowing of the airways that can lead to respiratory distress. And the final B is for bronchorrhoea, the excessive production of watery secretions in the airways, which can literally drown a patient if not managed. Together, SLUDGE and BBB provide a comprehensive clinical picture of muscarinic signs from acetylcholine excess. This is what we see in cases of organophosphate or carbamate poisoning, nerve agent exposure, or even an overdose of a cholinesterase inhibitor. The presence of these symptoms, especially the respiratory and cardiac signs from the BBB mnemonic, signals the need for urgent intervention. The primary treatment often involves administering atropine to block those muscarinic receptors and reverse these critical effects, along with other supportive care measures. Recognizing these signs early allows us to initiate treatment promptly and improve patient outcomes. That's all for today. Thank you for tuning in to Emergency Insights. I'm Kim Barker, and I'll see you next time.